name is Dr. Raj Chovatiya. I'm an associate professor at the Rosalind Franklin University of Medicine and Science, Chicago Medical School, and founder and director of the Center for Medical Dermatology and Immunology Research in Chicago in the United States. It was my pleasure to be a faculty member and presenter at the EADV conference this year in Paris, where there was really a lot happening in a number of different disease states. And rather than making you watch me spend several hours talking about every update, I want to highlight a little bit about what's happening in the atopic dermatitis and eczema world, as I feel that there's been a lot of both research updates as well as symposia that I had the privilege to participate in that really delivered new educational content. So I think one of the big stories thus far this year has been updates in medications that we are quite familiar with. And I'll touch on a couple just because we've seen some interesting data disclosures come out about long-term data. Abrocitinib is one of those medications, an oral Janus kinase inhibitor that's been on the market for a few years now. And we saw both a long-term safety update from the clinical trial programs going longer than 6 years that showed that in general, everything we've seen from safety at 1 year, 2 years, 3 years has been highly consistent. And in general, the main things to think about when starting an oral Janus kinase inhibitor for patients is typically going to be thinking about certain baseline risk factors, whether we're talking about smoking history, whether we're talking about older age, or potentially even baseline presence of certain cardiovascular risk factors. We've seen some real world data for abrocitinib as well. And a lot of this has come out of China in terms of very large data sets looking at the use of abrocitinib in the real world that have suggested very consistent efficacy as well as safety with what we've seen described in the clinical trials. And these type of data are always very helpful for us because it's very nice to see exactly how a medication is getting used in the real world and whether it matches up with what we've seen in the clinical trial programs. To that end, there's been some other updates in the abrocitinib program as well too. We've seen some updates from Jade Real, which is a study that actually looked at patients who started the medication and continued on the medication before its commercial availability. And that was very, very helpful to show us how dose handling occurred. And we've also seen other updates in the abrocitinib world that have really allowed us to understand a little bit about how doses in general are used between the 100 milligram and 200 milligram arms. I'll speak a little more broadly now about the atopic dermatitis space, as another major story was the OX40 and OX40 ligand pathway. And that's one that I had the opportunity to not only participate as an author on research, but also as a presenter in symposia, really diving deep into the biology of targeting this particular pathway for atopic dermatitis. And for those of you that might not be super familiar with the biology of this pathway, a majority of our atopic dermatitis treatments at the moment target individual cytokines or individual signaling pathways that tend to be highly downstream as far as the inflammatory cascade goes. In the case of the OX40 and OX40 ligand molecules, these are expressed on T cells, which expresses the OX40 receptor, and antigen-presenting cells, which express the OX40 ligand. And this interaction occurs before the activation of a variety of effector T cells. So the idea here is that if we could target a molecule that's slightly upstream to what we have right now, we might potentially be able to change the overall pattern of activation and even long-lived memory cells and even balance of regulatory cells in a disease like atopic dermatitis, and hopefully try to achieve some degree of stable disease modification or remission in the future. And so we had a chance to delve a little deeper into two molecules that are currently in advanced clinical trials. Most of the data updates were centered around rocatinlimab, which is an OX40 receptor binder. This one is really sort of thought of as a T cell directed therapy that is going to deplete pathogenic T cells that tend to be overactivated. And thus the idea is that perhaps this may have a rebalancing effect in the immune system as it relates to atopic dermatitis. So we saw data updates looking at both monotherapy and combination studies that showed that this drug met its primary endpoints. The main takeaway here is that this mechanism of action is going to probably be a little slower than the ones that we have on the market and perhaps may require topical corticosteroids to start, but potentially the payoff of having extended dosing and or even the ability to discontinue dose is one they're going to look forward to over the next few years in future conferences. We also saw some updates from the amlitelimab program. This is an OX40 ligand binding antibody. We saw some longer term safety that came out of the previous phase 2 trials, as well as looking at individuals who managed to maintain higher level endpoints from those trials as well. These data seem promising and definitely gave a lot of credence to the phase 3 clinical trial programs. We've also seen some press release data of the phase 3 clinical trial programs, but a presentation of those data is still pending and not something that was delivered at EADV this year. I'll also like to touch on the fact that there's a couple of different areas of atopic dermatitis that we've had a chance to focus in heavily. Head and neck disease is one of them, a major problem, not only around the world, even where I practice, a big problem in Asia as well. Head and neck atopic dermatitis is very tricky and challenging to get control of, knowing that there's a big mix of contact dermatitis, environmental allergens, atopic dermatitis, and other things that make this a very special site and difficult to treat with our current therapies. So in our symposium over a couple of days, we had a chance to talk a little bit about biologic therapies, the role they may play here, and some of the compelling data that we've seen, particularly in IL-13 blockers like tralokinumab, but also lebrikizumab, that may perhaps offer us some different options for patients that either have difficult to treat disease in the head and neck, or potentially have had this rare and somewhat unique constellation of symptoms that seems to occur in a small percentage of patients that are treated with dupilumab. The final update that I'll share is one in the eczema world, but not specifically atopic dermatitis, but seborrheic dermatitis, a extraordinarily common condition that oftentimes can overlap in patients with atopic dermatitis, but has many pathogenic features similar to not only eczemas, but also psoriasis as well. And I had a chance to deliver an oral presentation delving into some of the sub-analyses that have occurred in the trials for roflumilast foam, a targeted phosphodiesterase 4 inhibitor that was really one of the first targeted treatments we've had approved for this condition, and one that's really shown remarkable efficacy in this disease. And we specifically focused on looking at various elements of diversity in terms of race, ethnicity, and Fitzpatrick skin type among patients to show those consistent responses of this particular medication. But we also had a chance to focus on hypo and hyperpigmentation, which can be elements of this disease state that are especially notable in people with darker toned skin. And what we found was over the course of treatment, this actually corrected quite nicely, along with improvement in signs and symptoms. And so future efforts for research are really designed on understanding if this is more of an indirect effect of treating underlying disease itself, or perhaps more of a direct effect that phosphodiesterase 4 inhibition may have on pigment itself. Bottom line, this has been a very, very busy, fruitful, and productive EADV conference. Those are just some of my personal highlights, and look forward to sharing some more with you in the near future. Thank you.